Good evening, everyone. I'm Lonnie Friedman, the Health Literacy Specialist with Vaughan Public Libraries. I'm located, despite my background, in the Cortellucci Vaughan Hospital. So today we have quite a fun, quick presentation on FluWatchers and the flu season as a whole. We have a special guest here, Dr. Miles Smith. Before we start in earnestness, though, I'd like to do a land acknowledgement. So Vaughan Public Libraries respectfully acknowledges that our libraries were built upon the territory and treaty lands of the Mississaugas of the Credit First Nation per the Toronto Purchase Agreement, or Treaty 13. We also recognize we are situated in the traditional territory of the Huron-Wendat and the Haudenosaunee, who occupied this land before the arrival of European settlers. The city of Vaughan is currently home to many First Nations, Inuit, and Métis people. We acknowledge their contributions to the life and prosperity of this land. As representatives of the people of the city of Vaughan, we are grateful to have the opportunity to work and live in this territory. So our special guest today is indeed Dr. Miles Smith. Dr. Smith is a family doctor who works in Northwest Toronto. He has experience with diverse populations, including newcomers to Canada, and members of the LGBTQ2S+ community. He also loves to bring his 3 children to the Bathurst Clarke Library on a regular basis, which is so nice to hear. So with that being said, I'm going to share my screen and we'll get into Dr. Miles' presentation.
Okay, thanks so much for the introduction. Very kind of you to do that. So just wanted to go over a few things in terms of what I'm going to call Influenza 101. Prepare this for you guys specially. So it was fun to just review and update things for a public-facing presentation. One of my colleagues, I showed some of the slides, is like, I want to print out of that slide so she can put it up on her wall. So actually ends up being clinically useful too. So I'm actually based out of Rexdale Community Health Center, which is the northwest part of Toronto. The next slide actually has our own land acknowledgement. So we won't go over it, but I just want to recognize that it's really important. I think it's really valuable to recognize where we're coming from. Okay, so just moving on. When you ever see a medical presentation, you often see this. I'm not in industry. I'm not in research. I actually have just a normal family doctor, so I have no conflicts of interest to declare, apart from me being a family doctor and wanting to see people be healthy. Okay, so just going to go over a quick outline. We're going to go over what is influenza. We're going to go over symptoms. I have a nice comparison chart anticipating some questions. How do you tell what this is? And so that goes into diagnosis. Prognosis, a term that we say for medical speak for saying what do we think is going to happen. And we go into treatment and prevention. I sort of go through in this order because I want the final little tidbits in your brain to be really think about how can we prevent influenza. So that's going to be a take-home message from my side of things. And Lonnie is going to also present on FluWatchers, which is a separate piece of information. Okay, so just going through things really briefly, but importantly, influenza is the term for the illness that we use that is caused by the influenza virus. Okay, this is something that's very contagious, goes from person to person, and it changes every year, which is why we tend to see it prop up over and over again. This is mainly one that affects the upper respiratory tract, so that's the nose, the throat, and the lungs. Okay, we'll see some symptoms affect other people, some people in other locations, but that's the main thing. And think of it as usually upper respiratory tract. In Canada, our autumn and winter months is when we usually see it because that's when people are congregated inside. We'll see a lot of children get it because I got 3 kids, they're germ factories. If one kid gets it, by the end of the week, everybody in the class has it. So this is something that's easy to spread, and it's usually through coughing or sneezing or close talking through droplets. Certainly it can be spread through contaminated surfaces. So someone sneezes and, all over a table. If it's non-porous, so we think about our, like a plastic table or things like that, and, they sneeze or things like that. Oh, that's contaminated. Or you think about sneezing And, they try to teach my kids, sneeze into your sleeve. Don't sneeze into your hand. Why? Because you use your hands for everything. So you give your friend a high five. Guess what? You just gave them all the germs, or you just got it from them, especially if they've had a cold and full of germs or stuff like that. So we will see it at other months. I'll use this as a learning opportunity for you. That's not on the slide. Oftentimes it is during when people are together, but even in previous years, sometimes I'd see symptoms that sounded like influenza in August, which is like, whoa, we're really early for influenza season. Is it a big deal that it happens to be in August? Well, it depends, because that's before we get the flu vaccines available. And usually by the end of the winter and the springtime, I actually don't see a lot of influenza in the springtime, because either people were outside or people have been exposed to it and just didn't get sick with it. So it's not really happening out there too much. So basically, I think of influenza as sort of like beginning of autumn to through the whole winter. Okay, so that's a summary about influenza, and we're going to talk about symptoms next. So really, we're going to focus on influenza first on this slide, talk through some of the details of this, and then we're going to have a comparison chart on the next page. But really, it's a constellation of having a cough, having fever or chills, and having muscle aches. Now, it's important to think about what all these things are. It's not necessarily the virus causing these things directly. It's actually the immune system trying to clear the virus, get it out of your body. So why do we cough? Because we don't want the virus to be in our body, so we cough it out. Or we have phlegm, runny nose, mucus, and that traps the virus particles, and we cough to clear that out. Okay, especially in our lungs. So if you have a runny nose, you might blow out that runny nose, but also goes down the back of your throat. It goes down into your stomach if it's sitting upright, or it might some of it go breathe it into your airways, go past the vocal cords. And your body doesn't want to have mucus and that's full of virus particles in your lungs. So what do? We cough it out. So that's why it could be a dry cough without the mucus, or it could be a wet cough, or it could be with mucus, because your body's trying to clear that out. Incidentally, along those lines, why do we talk about is a productive cough? Some people may say, oh, it's white productive cough, or it's yellow productive cough. That really doesn't tell us a huge amount, apart from saying that your immune system's working. White blood cells are immune cells, so that's what gives it originally the white color. And yellow is sort of mix of dead white blood cells, a mix of grossness and things like that. So the yellow doesn't mean that you're more sick. It just means that, oh, you've been having this infection for a little bit. So some of the cells have been changing over, have been dying as they fight the battle against infections. So that, excuse me, sorry, I've got my own cough here. You got to drink some water as I go along. So that's why we got to think about what's going on with cough. So fever and chills, again, that's your immune system. That's your body changing the thermostat in your body, just so that you make it less hospitable for the virus to replicate. It's very interesting, the viruses and other infections, so bacteria, for example, will be used to growing at your normal body temperature. So when you add a fever, that basically your body is trying to make it inhospitable for that. Okay, and muscle aches are related to inflammatory response as well. Okay, so hopefully so far so good, but I'll mention these things on the next slide in a minute, but let's talk about the other symptoms that we can have when we compare it to other things. Okay, so headaches, that's stress, dehydration, lack of sleep, that's fine, that it can happen. Tends to be tension headaches, but someone has migraines, they might show up like that. Oh, we got a new person joining the waiting room, perfect. We have loss of appetite. Loss of appetite is normal. So one thing I always suggest to people, like, don't worry, may have loss of appetite, especially in kids, just as long as they make sure that they have their hydration, that's fine. Fatigue is feeling tired. Sore throat is usually because the immune system has extra activity in the throat. Okay, I won't go into too much extra details, but just to briefly mention, we have lymph nodes that are part of the immune system, and they can get inflamed, become sore when we have infection. And you can get a sore throat without having a large lymph nodes, but I just mentioned that. And nausea, vomiting, diarrhea. our classic gastrointestinal trio. That's basically your body saying, okay, you know what, like maybe some is affecting us and we've got to clear it out. So diarrhea, get the poop out of there and take some of the virus with you. You tend to see that more in children, but certainly adults can have that. Okay, so again, cough, fever, chills, and muscle aches. Those are the constellations, especially the muscle aches. And the other stuff may or may not show up. Okay, so that's influenza. Let's do a comparison chart on the next slide, please.
Yeah.
Perfect, thanks.
There we go.
Okay, so very helpful comparison chart. You'll notice the last column there was added in the last couple of years. So you'll notice influenza and common cold have some distinct differences. And you'll notice that influenza and COVID-19 have a lot of similarities. And that's mainly because influenza and COVID-19 tend to make people sicker, okay? Where the common cold tends to be, lighter duration and, shorter duration and later intensity of symptoms. So influenza and COVID-19 have a lot of the similarities because they're both provoking a stronger immune response. There's two differences, nausea and vomiting diarrhea. To be honest, you will see it in COVID-19 more across the board. Certainly kids will get that, but influenza would be more the kids than the adults. The other thing that is pretty distinct is the loss of taste or smell. That's in COVID-19. That's because the virus can affect the olfactory nerve. And we see some other neurological involvement at times. But basically, that can happen without a stuffy nose. Common cold, you can lose the sense of taste or smell if you have a stuffy nose. Common cold really tends to stick up in the nose, and you can get secondary sinusitis or sinus pain, or kids can get inner ear infections called otitis media, but common cold really tends to stick up here. So when you look at the symptom pattern for common cold, which is a variety of viruses, so that we umbrella as the common cold, you'll see that they will get the cough because of the mucus generation. You might get fevers and chills, but that happens less often. Muscle aches sometimes happens because they tend to be more mild overall. You're not usually getting the headache because it's less intense. Sometimes, especially kids will have a loss of appetite and make you feel tired, and sometimes we'll get the sore throat. And then the runny nose is common for everything, but you really common cold shouldn't be having any lung involvement. If you get some lung involvement, that's something else. Doesn't mean it's bacterial, could be viral. We'll talk about RSV if we have the time. I have a slide for that because I know that's in the news, but I do want to focus on everything else first. RSV will only be if we have extra time, okay? But I just want to acknowledge that this is sort of what runs through my head. And as a doctor, I'm looking at the symptom pattern saying, is the person having muscle aches? Okay, that's probably influenza, or now it's like, oh, that might be COVID-19. So that's in the last 2.5 years. Common cold would be like, oh, no muscle aches, definitely runny nose, some stuffiness, but not so much distinguishing between influenza. So hopefully that makes sense to people. Hopefully that's enough time for everyone to absorb the information on this chart, and can always jot down if there are any questions about that. Okay, but let's move to the next slide, please, and thanks. So like I said in a little bit, it is challenging to distinguish exactly to say, aha, this is 1000% influenza versus something else. But oftentimes we don't really need to in family practice. Now, there are some settings where lab testing is available to say, okay, we're going to test for influenza. So for example, when a patient's admitted to the hospital, they'll often get some swabs done, and they'll be testing for influenza, they'll be testing for COVID-19, RSV, and they'll do run a lab test to find out technically what this is, because if someone's hospitalized, someone's unwell, so we want to make sure we know what's going on. But in common practice, we're not doing swabs, okay? And again, and this is going to be for respiratory focused infection. So for example, someone has strep, we worry about strep throat, or they have a sore throat forward presentation, then we'll do testing for that. But that's a different situation than we're talking about today. Okay. So the next slide goes over prognosis. Is what we think about, is a medical term for what we think will happen. And the good news is most people will recover within 7 to 10 days. The bad news is people will feel really lousy with influenza if it's a full-blown infection. So all those symptoms really suck being the technical term for what we're seeing. Common cold is like, okay, I feel lousy, I have runny nose, stuff like that. But influenza is like, oh, you know what? I feel like being in bed all day. I feel like muscle aches. I feel sucky. Okay. Some people will be at higher risk of complication or hospitalization. So generally, if someone has chronic health conditions, let's say someone has diabetes, they're at a higher risk of a worse outcome. Doesn't mean that they're going to, go straight to the hospital, but they're at risk of having complications, hospitalization with that. So for example, with my patients who have diabetes, we encourage all of them to get the influenza vaccine every year. Nursing home residents, another population that are high risk. People who are pregnant, so they do have a higher risk of complication, but they probably won't be at the same level as someone who's nursing home resident. In people who have indigenous background, and I'm going to use as an umbrella term. Okay, so a lot of that includes people who are First Nations, people who are Métis, people who are treaty, and some people who are non-treaty for various reasons, but they come from indigenous backgrounds. That often has to do with socioeconomic access to resources and where someone might be living. We have a great number of first people who are indigenous, identified as indigenous in Toronto and in the Greater Toronto area, who may be in a different set of circumstances from someone who is living on their traditional lands. But we incorporate, again, in terms of overall trends, we think, okay, we want to encourage our people who are First Nations or Métis or indigenous background to think about, just monitor them self-monitor for your symptoms. Children under 5 years old, especially children under 2 years old, at higher risk for complications. Again, doesn't mean that you're going to send every child to hospital, not by any means, that's not practical. But it just means that we just want to have a conversation with parents proactively rather than reactively. And adults who are over 65, we actually have at our clinic, we do a data poll, and all of our patients who are over 65, we give a phone call to either book them in for a flu vaccine clinic, check if they have a plan for it, either the pharmacy or a local, wherever they live. Some buildings have outreach teams, and we'll have a conversation with them every year. That's done by my registered nurse colleagues. They do a lot of work to make sure we help our patients in our practice. And I just want to say, as a take-home message, risk is a spectrum, not an absolute. So just because somebody has one of these categories doesn't mean that they're definitely going to have a complication, hospitalization, but we take it all of these as a factor. Okay, so let's move to the next slide, because most people, talking about treatment, most healthy people will not need medical treatment. And I use that term medical treatment to mean pharmacological or a physician or nurse practitioner led interventions. A lot of it is what we call conservative care, which means that is making sure the person gets rest, making sure it stays hydrated, and using some symptom relief strategies, okay? That's basically trying to give your body a chance and support your body to let the immune system do its work. Resting means you're not putting a lot of strain on your body. Fluids means that you're going to make sure you don't get dehydrated. And symptom relief strategies, that could be different things for different people. And oftentimes it can be culturally informed strategies. So some people, like I happen to be half Chinese. I have my Chinese side of the strategy, Chinese side of my family. A lot of it will be, hey, let's try ginger. It seems to be the answer for everything. And different things to make you feel better. Great. If that's what you find makes you feel better, great, go with that. If you're having the muscle aches, okay, we can take, as long as you don't have allergies or other contraindications, take some Tylenol, also called acetaminophen. I happen to buy generic. It's the exact same medication, so acetaminophen. In some populations, taking ibuprofen, also called Advil, or long-acting version would be naproxen, also called Aleve, would be appropriate. I do double check that one separately because generally acetaminophen is very well tolerated by most people unless they have allergies or liver issues, whereas more people will have some sort of, not everybody by any means, but there are more people who have ibuprofen or naproxen contraindications or reasons they can't have it. So double check with your healthcare provider if you have any questions about that. Could be non-pharmacological, could be like you have a heating pad, put it on your neck or put it on your forehead, or some people find ice actually makes them more comfortable, okay? Some people have their comfort foods, okay? So my wife always says, okay, you have a cold, okay, we'll order some chicken wings because chicken wings for me is my comfort food. So having something that you enjoy, that you can eat easily, whatever helps with your symptoms, great, and get some sleep. Okay. And then we do have antiviral medications for people who are at highest risk. The most effective if used early in the course of someone's illness or symptoms. So for example, this is someone who, but it does depend on the context. So regardless of, for example, I usually want to use this example, someone's hospitalized with influenza, they're going to get the antivirals because they're going to be sick enough, even if it's going to make things just a little bit different, they're going to get antiviral medications, honestly, not any contraindications. In nursing home residents, they say there's a public health declared influenza outbreak. They know that people can pick up or transmit and therefore give the influenza virus to other people even before they're symptomatic. But usually it's about a day before they have defined symptoms, and 5 days afterwards is when their peak ability to spread influenza is. So you think about patient A in nursing home, they might be visiting their neighbors, or they might have a nurse or PSW visiting, and they might pick it up. Despite our best efforts, nursing home residents may get antiviral medications when there's an outbreak. Okay. I will use this moment to mention, as I mentioned you don't have to go back to the previous slide, but just mentioned on the previous slide, you have some higher risk populations, like person who's pregnant or children under 2, for example. They're not routinely in Canada going to get antivirals. We're talking in the context of people who are at the highest risk population. We just want to make sure we have that conversation about what people are looking like. Okay. Okay, great. Let's go to the next slide, because this is probably, I think, in my opinion, the most important slide of them all. Because why would you want to go through that and say, yeah, you know what? Yeah, I got the flu this year. It's like, I don't really want that. So let's always just take a moment to think about how we can prevent it. Okay. Getting the flu vaccine in autumn every year when it becomes available is really important to help repair your immune system, because this virus does mutate every year. The influenza vaccine gets updated every year because the strain is going to predict what the strains are. Every year, we try to get it into people's arms, and they try to have it update what's going to be, what we're probably going to see. Hopefully, they match what we're going to see in Canada in our provinces. How effective is it? Usually, it's variable. Some years it's like 50%, and I'm thrilled with that percentage, because that means that somebody, 1 in 2 chance of having not getting it all, or not having as intense as symptoms and outcomes. Okay, 50% is really good threshold. I've had years when we look at the data and it's like, okay, you know what, it seemed to be like 60%, great. Some years like 40%. Great, that's still 40% decrease. And that's really important, because we know on the big scale of things, that means that many less people are getting it. That means that it's being spread that less amount. And that means we can protect not only ourselves, but people who are vulnerable around us. Okay, so that's really important. Our patients who are over 65, and a couple of patients will get high dose of flu vaccine, because we want to really super stimulate the immune system. Because those are people who may have a less robust response. And we know that every vaccine, regardless of every single one that we get, has a chance to, because it's stimulating the immune system, causing, sore arm, wherever you get it, like shoulder, right shoulder, in your leg, in your bum, wherever you get it, has a chance, depending on the person's age and your, you can get a sore arm, can get a little pinkness, shouldn't be a red like an infection. This is not a live vaccine, so it should not get you sick, but you might get a low-grade fever because it's ramping up your immune system. Nobody really likes a ramped up immune system, but all it takes is 1 year where you're like, oh shoot, I got the full-on flu, and you think about what that was like versus what it was like for the flu vaccine. Like, people will have told me, you know what, I'll get the flu vaccine this winter because what happened last year was really a lousy experience. And like I said, it's not a perfect prediction. Not everyone would get that benefit. But when I think about some of the medications we use, like for example, a cholesterol lowering medication we use, we're really thrilled if we get someone from a high risk to low risk in terms of their heart attack risk over the next 10 years. We're talking about high risk is 20%, low risk in other medications, I should say, going from high risk is 20% of heart attack or stroke, going to 10% risk or less of heart attack or stroke in the next 10 years. That's a 10% change of reduction, or 50% change, or you think a relative risk, 50% decrease. That's the same type of thing that we see with flu vaccines. So that means this is an intervention that actually does make a difference, especially when we look at the big scale. So that's probably the number one thing we can do to protect yourself. And this goes for all the other things like common cold, strep throat, COVID-19, influenza, hand hygiene, say for people who are sick, wearing protective masks, cover your cough, stay home when you're sick. These are things that we can do to protect ourselves and protect others, and just reduce the chance of getting sick in the first place. Okay, so hopefully I won't linger on those things because I think we've probably all heard a bit about those over the last 2.5 years. If people have any questions about any specific point, we can go back to that, but I'm sure all of us have heard about those topics over the last 2.5 years, so I focused on the vaccine off as a slide. Okay. One last thing I should mention on the previous slide as well. The flu vaccine can be given as young as 6 months. Anyone who's getting their first vaccine as a child, you want prevention, one more slide. Good, perfect. We'll get 2 vaccines. So I did this for my kids. I've got 3 kids, like I said, and flu vaccine is 6 months old in winter, or 6 months old and over, and it's awesome. It's available, appropriate for the season. Get into the arms, repeat a month later, and then they got their flu vaccines for the winter. And then we get it every single year for our kids. Okay, so that's my presentation. I want to say thank you for everybody. I can't see anybody smiling or putting their hands up because there's no video, but this is probably a good opportunity to open up the floor to questions if you have any, please and thanks.
Yeah, feel free to put them in the chat. While people are writing their questions, if applicable, I'm now going to share my screen once again, and thank you, Miles, for going through that. That was really great. I'm going to, while you're pondering about potential questions, I'm going to show everyone how to become a flu watcher. That's the other half. So this won't take very long, and this is on purpose because the government has made this quite intuitive. And so FluWatchers is relatively new. What it is you sign up and it's anonymous. And so I've already signed up about a month ago. And once a week, it's typically on Mondays, you'll get an email asking you to answer a few questions. So I have mine set up. All it does is record the first 3 letters of your postal code. And so we're going to walk through what it actually asks. So here's mine. We'll go through it. You hit start. Oh, sorry. Let me go back to my mail because that would have been a while ago. Let's see. Deleted here and follow my link. Okay, let's try again. Here we go. So it asks you 3 quick questions for the week of October 30th to November 5th. Have you had any symptoms? So no. Have you had a cough? No. For the week of this, now it's asking for, they also implement a COVID question. So antigen test. So the answer is no. And between October 2022, and now have you received the vaccine, the flu vaccine? And yes, I have. So I hit submit, continue. There it is. It says I'm the 3,402nd person in Ontario to submit. So here is why this is so important. As you can see, it took me about 20 seconds, even going back into my mail to get it and answering their questions. Now what they do is they aggregate all of this information every week. And so health professionals can see trends. So for example, if we click here, it will show trends within our area as well as in Canada. So you can see how many people have participated thus far for this beginning week, how many have reported that they have a copper fever, including COVID-19. And what's important about this too is a lot of people who will get the flu, they won't necessarily go to the their doctor or the hospital for that matter, and get officially tested. As Mel says, it's fairly rare to get tested proper. And as such, this gives us a clearer sense of these trends. So self-reported. So here's the map for this week. And if we zoom in, I'll try my best. Give me a second here. We'll zoom into our general area. Let's see. Yep. And we're in Vaughan. Let's see here. Here we go. So we'll just click here. So in this general one so far, and today is the first day of the week, so that's why the reporting is lower. You can see 3 or 20% of the people have reported. Now, if I go back here, this is also interesting with the reports. So we can see here thus far, since last week, they almost reached that 5% positivity threshold. And once that's official, then the influenza epidemic will be declared by the government. And so it really breaks down all of these numbers. And so having all this data, as you can see, it really just took 20 seconds. It's quite easy, but having this data is critical because once they have that, the governments, provincial and federal, can start planning things accordingly. So besides getting your vaccine every year, this is the second most helpful thing you can do. All right. Oh, so we have a question here. So one person asks, can there be a conflict with many simultaneous vaccines, COVID, flu, shingles, pneumonia, all in the same 2-month period?
That's a fantastic question. Excuse me. That's a fantastic question to think about, and because we want to think about how our immune system works. So the good thing overall, most people should be able to take simultaneous vaccines. Just going to clear my throat for a
moment. Yeah, feel free to get some water too.
Sorry, I got my cup of water.
Oh, that's good.
Here, right? Yes, I spend my day talking all day.
Exactly.
So
this is not flu related. He doesn't have the flu.
Yeah. So the good news is that our bodies are constantly exposed to germs, whether it's viruses, bacteria, even funguses. So our body is constantly bombarded with things that could make us sick, but we don't actually get sick because our body has built-in defenses against it. We should be able to handle multiple vaccines. In fact, we do that very routinely for even babies. So, for example, let's think about it. A 2-month-old baby gets Pediasel, which has diphtheria, tetanus, and pertussis, and polio. And they also get the rotavirus oral vaccine, and they got a pneumococcal one. So that's 6 different things that we're introducing. None of them are live, and that's important to mention with the ones that you have here, except for shingles, which is technically an inactivated one. But those ones are all managed by a 2-month-old. Okay, we give we don't in Canada, but many countries overseas will give hepatitis B to newborn babies. Like you're born, boop, there you go. So, hopefully they wash off the kid first, but, all the jokes aside, your body should be able to handle that. There are some specific populations why we might separate things out. For example, young children, COVID-19 vaccine may be separated out by a couple of weeks, not because we have any particular concerns with with it, but we've just is because I think what's basically happened is like we want to make sure we know if any reactions are due to, is it due to the flu vaccine or is it due to the COVID-19 vaccine? But allergic reactions are relatively rare for a true allergic type reaction. Sometimes there's like, some people have egg allergies. You have a conversation about it and double check with them. If it's a mild one, usually you should be able to give that still because it's such a tiny amount that it could be cross-contamination, but you have a conversation, you check in with the person. And I should mention our age 65 population, we give pneumococcal, an anti-pneumonia vaccine. We give, which actually has 23 different strains of it. We give a shingles vaccine that's to protect against reactivation of the herpes zoster virus. That's definitely one to get if anyone here in the chat is between age 65 and 70, I believe you're fully qualified, but you actually have a extended window because of the COVID-19 outbreak. I can see if I can double check in a few minutes what that age is up to, but I think it's definitely age 73, maybe 74, because this is a very helpful shingles vaccine to get. You get some protection against reactivation. You have to get your 2-course done earlier, and then the target age, which again you'd have to double check what Ontario said will pay for it. It's not a cheap vaccine. I remember when it was brand new and it was very exciting. And it was like, oh, it's triple digits. Not everybody can afford it. Now it's covered by the government because it makes a difference. It's financially feasible to keep people healthy and out of pain crisis and things like that, and keeps them out of hospitals. The government says, yep, we'll pay for it. So you can definitely handle that and the flu vaccine and the COVID vaccine all in one visit. That's a fair bit. Technically, you could toss in the tetanus vaccine if you had it in a while. You might feel like a pincushion, but certainly your body can handle it. So that's a very big, comprehensive answer. And I really appreciate Jamie adding in, asking what's it said to be inactivated or dead virus. So viruses or vaccines, let's take a step back. These days, most vaccines are using particles or proteins of the virus that the body will use to identify and say, aha, I've seen this little squiggly bit on the outside of the virus. Let's identify that as something we should tag and send our immune system after to protect ourselves. So that's when, that's what quite a number of vaccines will use. Some vaccines, we tend not to use the dead virus ones anymore, but some of them probably are. Inactivated ones are basically viruses or chopped up or deactivated ones. What's the best way to describe it? Basically, they're very weakly live because they will cause a better immune response than we'd had with the particle ones. That's things like measles, mumps, and rubella, and varicella or chickenpox. Those are ones that are inactivated. But you kind of needed to make sure you have a good response, especially since those are all hyper transmissible ones, because you really want to make sure you don't have a measles outbreak, not only because it can be dangerous, but like we're talking about, like, oh, you sat in the same waiting room as somebody, there's a chance you pick this up. More than like, influenza, you could get the particles floating through the air, the droplet particles floating in the air, you can breathe it in across the room, but it's much more closer distance type of thing, okay? And then, I saw this text message, to poor atmosphere condition, and Diwali candles. Oh, okay, Diwali, this is more, I saw a headline, I didn't read any articles about Diwali, and wait, actually, can you just double check to clarify? In the news, they were talking about fireworks. Do you mean distinctly fireworks and rockets and up in the air, or do you mean any candles in the house? Maybe you can add that to the text. in the chat because I love to answer that question most accurately. But in terms of what I remember talking about meteorological people and the weather, because I did see that alert bad air. Oh, sure. Yeah. Yeah, go ahead, unmute, and then love to hear your specifics.
Hi, thank you, Doctor, and I certainly appreciate this event here. Yeah, so I was surprised myself that not too long ago, some meteorological professional said that Diwali candles were causing a problem. And someone countered, why don't we have this problem in July when there are more fireworks than Diwali candles? And they said something along the lines, I can't remember what it is, a weather mask, this or that. So I was wondering if such conditions, weather conditions, make it easier for germs to be transferred.
Okay, got it. Okay, yeah, so I'm not a weather scientist by any means. I recall the headline talking a bit more about asthma being triggered. I certainly, it may not be fair for me to guess the weather side of things. So I'm going to put on my doctor hat, then a weather person hat for that. But like I know for certainly people who have sensitive lungs for different reasons, but I'll use the example of asthma and allergies because I actually have allergies. You know, if I have smoke exposure for me personally, or I smell perfumes, or I have somebody who came into the office today and they have multiple cats, not just one cat, but multiple cats. I felt my airway go, and it's like double checking. I don't smell any perfume on you, but just double checking, do you have perfume? It's like, no, but I have cats. Could that be? It's like, okay, that's my allergies acting up. Okay, so I would wonder if the meteorological situation with Diwali candles versus the summer be a factor there, because maybe I do have some patients coming over from Brampton, and Diwali is a big deal, and they were telling me, I haven't participated in Diwali in Brampton, but you know, certainly some people in my neighborhood up here in the York region, you know, there were some candles being set off, and I appreciate that. It's quite fun to watch fireworks. But if you're having everybody doing fireworks, you know, that can certainly make people's airways and airway conditions act up. I don't think from a doctor point of view that it would be more germ transfer, but certainly crowded conditions can do it. You know, everybody's in a crowd celebrating, someone's coughing, you know, you could have that outdoor transmission, even though we're not indoors and have, you know, poor air circulation by definition. Sure, hope not having fireworks indoors. You're outside enjoying fireworks. But, you know, certainly if there's a crowd, you can see somebody coughing and leading to that. Wow, that's way more of an answer than you probably expected to give, but that's sort of my thought process. I wanted to talk it through, you know, basing things on first principles. If you don't know the answer, try to look up or try to think through my reasoning. Okay. Okay. Any other questions? I'm going to mute myself, and I'll just see if I can look up that upper age limit for shingles to finish that thought.
Sure. Yeah, we have a little bit more time if there's any more questions.
Okay, so can I share the screen? Is that okay?
Yep,
Will that
go
work?
ahead.
Okay. Click on share screen and then share the window. Close by. So this is where's my scroll up and down? Okay, this is the vaccine schedule updated in June. Actually happened when I was on maternity leave. So I came back and it was like, oh, we have a whole new schedule. So if I go down to shingles, so I think it's how do they do this? I'm just trying to double check. Hold on a second. Ah, that's right. They have it listed under herpes zoster. So I should do a search. Herpes zoster. Okay, so usually it's done 65 to 70. Oh, you know what I'll do? I'll do shingles, Ontario. So shingles, Ontario. vaccine eligibility because they said, maybe this is the link. Qualify. Here we go. This is what I was looking for. So since immunization services were impacted over the past year, whenever they published it, people who were born 1949 to 1952 who missed the opportunity to get shingles vaccine are eligible to get shingles and have to complete it by 2023. Okay, so that would be 49. That would be 73, if I'm doing my math right. Could be 72, depending on when your birthday is. Okay, so I had somebody actually who's 74 and it was like, I just missed it. So sorry. Why they have it be that window is probably where the research was done at, original research. I remember looking at the papers when this is all coming out. It was like, okay, started at age 65 to 70, which when they studied was a study population, and there was originally 5 years of study. And it's like, okay, great. Then they did a 8-year study. It's like, okay, still working great. And a 10-year study, okay, still working great. And they stopped the funding for the research at that point. So that's why, you know, we don't know beyond that with great level of research, but we do know it's helpful. But I think because the original study population was in the 65 to 70 year window, that's the reason why governments are willing to say, okay, we have evidence for this, so we will pay for this. Because like I said, it is a expensive vaccine. If someone was older, we would have a conversation if they wanted private pay. Okay, so I'll stop sharing if I can figure out how. Oh, there you go. Click on stop share. There we go. Oh, can I share the website for Public Health Ontario? I guess. I mean, like that's a Google search. So, can you, Jamie, add in, or do you want to unmute if you, or type in more like what you're interested in about it? Because
Yeah, I put in the chat the website publichealthontario.ca, and then if we do Canada, here is the one for
right.
the FluWatchers.
Reporting. Okay,
Yeah.
got it. Yeah. There we go. That makes sense.
Let me put that in. Thanks for the clarification. I put that into the chat. It's simple as if you just Google FluWatchers, it will come up as well. But I've also put in the chat there.
Okay, I definitely appreciate that. It is challenging sometimes to see a provider. Sorry, I should read the question because it might not be showing up in the video. Perhaps off topic, a family provider has poor office hours, attendance, she is penalized if you go to walking clinic. That has to do with how the province has decided to fund some things. There are very quick high-level summary is that there's family health teams and family health organizations. They are funded and they're supposed to provide after-hours care and weekend care and on-call services. So yes, there's a financial disincentive or penalty for those providers if you go to patients go to walk-in clinic. In theory, it's to encourage people to have enough care hours that they can accommodate their patient practice and say, yeah, go make sure your patients are taken care of. There's a lot of politics with provincial funding, and I should mention that there's a lot of different governments that have gone through. So this is not a partisan, one party versus another, but just a lot of funding politics, regardless who's in charge, who want to encourage particular incentives and disincentives. I happen to work for a community health center, so my incentives are slightly different. I am going to see if I can pull up a website for, let me just pull up a website. I'm going to mute myself just so I can focus on that. Sure. But I think there's a website that for agencies where people can basically rapid response to a COVID, flu, and common cold, like basically upper respiratory tract clinics. And I will see if I can pull up that link, but give me a moment. I'm just going to mute myself for that.
Sure. Yeah. In the meantime, if anyone else has any Remaining questions for Miles. As I alluded to a little earlier, when you're signing up for FluWatchers, that takes about 60 seconds. It's quite quick. It asks some vague questions about yourself, nothing specific. You don't have to put your name as an example. You could even use an email if you're really concerned about anonymity, don't use an email with your name, but it is all anonymous. They just want to see the general trends within the community rather than anyone specific.
Okay, yeah, that's really important. I'm going to share my screen again. And let's go to public health. I meant to do this one. This is the appointment portal. And this is basically government spot. Now, I don't know how this interacts with people who have in a family health team or family health organization. But basically, there's different locations across Ontario. And this is basically sponsored, and you can get COVID swabs there, and you go through checklist, and then you sign up for things. And it gives self-care instructions as well. Okay, so you can book. You can also book your vaccines. Okay, so you can book your appointment. Let me go to the top here. Go to appointment booking. That goes there, and then your frontline worker. Go to that one. Go through your symptoms. So let's say. Just pretend it's flu. So fever, cough, some muscle aches on here, muscle aches. I'll skip the other ones. Go to book your appointment, and then you can select the service. Okay, and you go to what's the Cordalucci postal code?
Let's see. It is L6A 3K6.
Good. Okay, scroll down. Okay, so if I zoom out, because I haven't done this for myself at home. Okay, so this is mainly Toronto. We do have Oak Valley. We do have some Brampton there. So unfortunately, if you zoom out across things, well, of course, it's Ontario. This is a provincial endeavor. So we don't have it for Ron, but over here's my neck of the woods for work. You could zip down here. That's pretty close to the highway, or go over to, if you happen to want to go all the way across to Oak Valley, not sure where that is. That's probably more from Stouffville. You could sign up and they can do appointments, and you just put in, let's say this is B, and then you see, let's say tomorrow, do an appointment, click on it, then you put in your details afterwards. So you could basically, it's a one website start shop for getting COVID-19 testing booked online, and they'll do also an assessment. Could be something else in it. Okay, so care-clinics.ca. Okay.
Great. Yeah, thanks for that tidbit.
Yeah, no problem. This is relatively new. I think that started, I want to say about 2 weeks ago. So,
I
that's
see.
really cool. And you can always find out, I don't know if they actually have a phone number on here because it's a new service, but that might be something that, may or may not be an issue with your family health services. But, what you could do, I'll keep this open while we talk. You could always, sign up for it, and, or see if you can reach out to your primary care provider and see if they can get an appointment, and see like, look, I can go get my rapid swabs and get a PCR test at a assessment center. I think that probably would be okay. You might be seeing, I think at least ours locally is being run by nurse practitioners. I don't know how that interacts with people who have primary care providers in a family health team or family health organization. So I don't know that will affect billing, but like, at the end of the day, like, we all of us try to be practical. So, and something like this will actually get you, potentially get you a actual COVID-19 swab, might be more with the PCR testing. So like might be a little bit more confidence filling than a rapid test, that if you did have symptoms and you needed an assessment, you can go get that there. Okay. Okay, I'll stop sharing the screen and then
All right.
pass this over. Yeah.
Yeah, I think that was great. Thank you once again to Dr. Miles Smith. If you have any future questions about anything Vaughan Public Library does or want to contact Dr. Smith, feel free to reply to the original link I sent you, and we can answer whatever questions that might come up. So on behalf of me and for Vaughan Public Libraries and Dr. Miles, thanks everyone for joining. I'll stop the recording now.